So in this class we are going to see on the details of axilla region. So in pectoral region we had covered two important topics such as mammary gland and about pectoral region. Now we will move on to another important topic which is seen in pectoral part, in the upper limb part, that is axilla. So axilla, it is a region which is present between the upper part of the arm and the lateral thoracic wall. You can make out here, which is otherwise known as armpit. You might be heard in your day-to-day life. Armpit is nothing but axilla region. So armpit, which is present between the upper part of the arm. So this is the arm region. In this part will be called as upper part of the arm, and this region will be called as lateral thoracic wall. So between these two areas you will be having one space. That space will be called as axilla. About the details of this region we will deal later. For orientation, you just go through on the points whatever I'm telling. So we will be having a space present between the upper part of the arm and the lateral thoracic wall. The space we will call as axilla, and this axilla again will be having some more parts because it is shaped such a way that it will be conical in shape. So if a space is conical, it obviously will be having boundaries such as apex, base, anterior wall, posterior wall, medial and lateral wall. So these are the six parts we are going to see detailing in axilla. So these are the parts which are present in axilla, and more important, we have to see the space with its contents. So before moving on to the space, first we have to remove other covering areas or covering muscles which is surrounding this axilla region. So in this axilla region, anteriorly you are seeing a muscle called pectoralis major. So if you remove this pectoralis major muscle, you will see another muscle present below the pectoralis major, which we will call as pectoralis minor. So once we will remove pectoralis minor also, you can get a small area here between the arm and the lateral thoracic wall. That area is nothing but axilla. For our easy remembering, we can remove the long head of biceps brachii also. So if you remove biceps brachii, the space and the contents whatever you are seeing are considered as axillary region, and this region will be carrying very important structures which are to be present in this particular region, which we are going to see now. Okay, so now we will move on to the details about this region. So in this region, while you are seeing, you can make out some important vessels seen in this region. So this is the axillary region, which is somewhat triangular in shape or conical in shape. In this you can make out an vein here. So that vein is nothing but right axillary vein. You might have already known the picture. What we are depicting here is right sided human body. So right sided specimen with right axillary vein you are seeing now. So then after, if you are removing right axillary vein which is present in the axilla, you can make out another important structure present there. So that structure will be called as nerve. You can see many yellowish structures passing through. So those structure is nothing but median nerve. So we'll be having median nerve, or you remember for now we'll be having contents of brachial plexus also will be seen in this axillary region. So vein we have seen and many nerves are passing, those are nothing but branches of brachial plexus. So once you remove this brachial plexus also, what will happen? You can make out other structures such as, if you are removing the muscle coracobrachialis also from here, and the nerves branches of brachial plexus, you can view important structures seen in the axilla. That is, after axillary vein you are going to see important structure, that is axillary artery. Yeah, right, they will be having axillary artery present here. So you can view here, this is the axillary artery, which is the major content of this axilla region. So axillary artery details also we will see later. So now two major contents you have seen. One is right axillary vein, another one is right axillary artery. Along with this, we will be having many green colored vessels. So those vessels are nothing but lymphatic vessels. So axillary lymphatic vessels also a content of this region. So three contents you have seen. One is axillary vein, another one is axillary artery, and the another thing is lymphatic vessels. Along with that, many yellow colored tubes you have seen, that is nothing but branches of brachial plexus. So along with this, some lymph nodes also will be seen. So to view the lymph nodes, we have to remove another muscle from here, that is deltoid. If you remove deltoid, you can make out in a clear image that we will be having some lymph nodes present in the axillary region. So in axillary region we will be having some lymph nodes present. See, these are the lymph nodes seen. Okay, so the lymph nodes will be seen here also in axilla. That lymph nodes we will call as axillary lymph nodes. So along with the lymphatic vessels, we will be having axillary lymph nodes. I think you people will remember the lymph nodes which we seen in mammary gland. The mammary gland main lymph nodes what we studied is about axillary lymph nodes. Here also we will brush up through those topics. But for first, you have to remember we have major contents, four in number. One is axillary artery, another one is axillary vein. Then we will be having branches of brachial plexus along with lymphatic vessels and lymph nodes. And here we will be having some fat present. While you are dissecting, you can make out those are called as axillary fat.